So, welcome everyone. Today's presentation is called How to Read, Use, and Interpret a Best Practice Guideline. It's a great pleasure to introduce you to our speakers today. First, I'd like to introduce you to Lindsay Howitt, Senior Manager for Guideline Development Research at RNAO. So Lindsay Howitt is a Senior Manager at RNAO for Guideline Development Research, where she supports the development and active uptake of evidence-based clinical and healthy work environment best practice guidelines and other research initiatives. Prior to joining RNAO, Lindsay practiced as a registered nurse in both acute and primary care settings. Her interests include health system transformation and supporting the engagement of people with lived experience in research and guideline development. It is also my pleasure to introduce you to Stephanie Buchanan. Steph Buchanan is a guideline development methodologist at the RNAO, where she's currently working on the development and active uptake of evidence-based best practice guidance. She's a seasoned master's prepared registered nurse with over 30 years of experience in nursing leadership, professional practice, education, and program development. She has a passion for social justice and patient advocacy. So welcome, Lindsay and Steph.
Thank you, Patricia, for that great introduction. It's a pleasure to be here today. We're excited to be sharing with you how to read a BPG. And in terms of our objectives for today, what we're planning on covering in our time together is to review the structure and key components of an RNAO best practice guideline. We'll be discussing how to interpret recommendations and good practice statements. We'll also be discussing where to find the information to support the implementation of recommendations and good practice statements. We'll discuss what best practice spotlight organizations or BPSO leads, change teams, and change partners need to prioritize in reading a BPG. And we'll conclude by describing how to link the BPG to key areas of the implementation frameworks in the Leading Change Toolkit. So with that, I'll hand it over to Lindsay.
Thank you so much, Steph, and it is a sincere pleasure to be with all of you today. Before we go into further details, we'd like to remind you of RNAO's integrated BPG model, which contains the guideline development pillar at the top, dissemination, implementation, sustainability pillar, and the pillar for monitoring and evaluation. These pillars all inform one another and they work in sync to impact the care for people receiving, or impact outcomes for people receiving care, providers, organizations, and the health system. As you read through a guideline, you'll find information about how the guideline was developed, tips and tools to support implementation of the guideline, as well as resources to evaluate implementation of a guideline in practice settings. When guidelines are being developed, 6 steps are undertaken, which you'll see on the screen here. So first, a decision is made to decide on the topic of the guideline and an interprofessional expert panel is convened. The panel is very involved in determining the purpose and scope of a guideline, as well as key recommendation areas that the guideline focuses on. Next, with input from the expert panel, systematic reviews are designed and conducted by the RNAO team. Peer-reviewed literature is reviewed and screened. These systematic reviews then inform the basis of guideline recommendations. The guideline is then drafted, and it undergoes feedback from external reviewers within Canada and internationally to enhance the quality of the guideline. Finally, our guidelines are published and we aim to commit to a 5-year revision cycle. I'd like to take your attention over to the right-hand side of the screen where we mention the word grade. GRADE stands for Grading of Recommendations, Assessment, Development, and Evaluation, and they support our rigorous guideline development process. We use GRADE at RNAO because it's in line with international standards for guideline development, and it's used by other large organizations to develop guidelines, such as the World Health Organization. When we're developing our guidelines and drafting them as well, we also use the Agree To tool, which some of you may be familiar with. And this is a tool to measure the methodological rigor of guidelines. So we want to make sure that when somebody is looking at our guidelines externally, they can meet the criteria to be deemed a high quality guideline. In the next few slides here, we're going to go through how to review, we're going to review the structure and components of the guideline and learn how to read, use, and interpret a BPG. During today's webinar, we'll be using several different BPGs to demonstrate where content can be found, but you may want to follow along by downloading a copy of a BPG, such as the Transitions in Care and Services BPG, which was published in June of this past year. All right. So at the beginning of a guideline, you'll find the table of contents. And today we're going to walk through a guideline from the beginning to the very end, and we'll start by discussing the first few sections that are highlighted in yellow here. So first, let's talk about what's involved in the purpose and scope. Within the purpose and scope section, you'll find content related to the population and settings the BPG is intended for and what the main purpose of the guideline is. You'll also find information about any topics that are outside of scope and aren't included in the guideline and how the purpose and scope were developed. You'll also find a list of other guidelines and resources that align with this topic area. Next, you'll find a page that says Interpretation of Evidence and Strength of Recommendations. So here in this section, it outlines the grade methodology to the reader and how we evaluated the certainty of the evidence for the research. We'll go into what certainty of the evidence means in a little bit more detail later on, but for now, all you need to know is that recommendations are developed based off of the certainty of evidence and that the evidence is either deemed to be high, moderate, low, or very low. On this page here, you'll see a summary of recommendations, or it may say summary of recommendations and good practice statements. More recently, you will be seeing more and more good practice statements that are included in our guidelines, and this is in line with grade methodology. On this page here, you'll see an example of a summary of recommendations from the 2S LGBTQI+ Health Equity BPG. The summary of recommendations table outlines all the good practice statements and recommendations in the order that they appear in the guideline, and it identifies the strength of the recommendation on the right-hand column. There are a couple of different ways of how we list recommendations in this table, and it may vary depending on a guideline topic. For example, the recommendations may be categorized according to practice education and organization recommendations. Or in this example, you'll see that the recommendations are grouped according to those that apply to inclusive communication, safer spaces, and risk assessment and screening. The research questions that informed the recommendations may also be listed in this table. You'll see in this example that recommendations receive a strength of strong or conditional, but good practice statements don't receive a strength, and we'll talk more about that later on. In 2019, RNAO transitioned to using the grade methodology for developing guidelines, which, as we mentioned before, it's an international standard for guideline development. Prior to 2019, the recommendations found in the guidelines were given a level of evidence that was associated with the type of evidence informing a recommendation. So if it came from a systematic review, a randomized control trial, or a non-randomized control trial, which are all different types of study designs. And you'll see on the left-hand side a list of how they used to be categorized in our guidelines that were published before 2019. In our guidelines published since 2019, you'll see that each recommendation is given a strength of the evidence that we talked about before, strong or conditional, as well as we talk about the certainty of the evidence, which is either high, moderate, low, or very low. In general, strong recommendations are associated with moderate or high certainty evidence, and conditional recommendations are developed based off of low or very low certainty evidence. But again, we'll talk about this in more detail as we go along. Next, you'll find the background context. And in this section here, you'll find contextual information that you, the readers, should know in order to have a better understanding of the BPG topic. So this might include information about pathophysiology of the condition, prevalence or incidence of it, health equity considerations to be mindful of, or perhaps guiding principles that should inform the care provided by health providers. So there's some really rich and detailed information that can always be found in the background context section. After this, you'll find a section on best practice guideline evaluation. So this section outlines indicators that can be used to measure the impact of implementing recommendation and good practice statements. So indicators are based on something called the Donabedian model, and they're categorized as either structure, process, or outcome indicators. Structure indicators are related to human resources and other organizational factors. Process indicators measure healthcare activities being provided to, for, or with people or populations. And the outcome indicators are developed based off the outcomes of the research questions. So they analyze the effect of the quality of care on health status of persons, populations, the health workforce, and organizations. So for example, something like patient satisfaction or quality of life or readmission rates, those might be all examples of outcome indicators. There's much more we could say about that, but we'll save that for another webinar. So on this slide here, you're going to see an example of how the recommendations get presented in the guideline, and you'll see that the recommendation gets listed at the top, and then below it, you'll see the strength of the recommendation. In this case, it's conditional, and it can either be strong or conditional, and the certainty of the evidence of effect. So in this case, which is very low. And again, it could be high, moderate, low, or very low. And as we noted, and we would like to emphasize that typically strong recommendations are based off of high or moderate certainty evidence, and conditional recommendations are based on low or very low evidence. So you'll see here that the conditional recommendation matches with the certainty of the evidence. And this is according to grade methodology as well. I will note as well that conditional recommendations are much more common in grade guidelines. So it doesn't mean that they are a bad recommendation. There's just additional factors we need to think of when implementing those recommendations. On this slide here, we wanted to show an example of how a recommendation question, so in this case, the question was, should the use of visualization technologies, such as an ultrasound or a vein finder for the insertion of peripheral vascular access devices be recommended? And then there's a number of outcomes that are listed. So success rate, patient satisfaction, and complications are some of those outcomes that they looked for in the literature. From this question, there was a recommendation that stemmed from it. And the recommendation was, the expert panel recommends that health providers use ultrasound-guided technique for the insertion of peripheral arterial catheters. So this was a strong recommendation. And from this, there was also indicators that were developed. So we wanted to show how the question leads to a recommendation, which then can lead to an indicator as well. So in this case here, the indicator was percentage of persons who received ultrasound-guided technique for the insertion of peripheral arterial catheters. All right, moving into the discussion of evidence section, this is going to be found in the middle of the BPG. So this is all the details that come from the systematic reviews that were conducted. So under each recommendation, there's a write-up, which we call the discussion of evidence. And the very first thing you'll see is a section called benefits and harms. This really summarizes the main findings from the systematic reviews related to any benefits derived from the intervention. And we also present any harms that may be associated with the intervention based off of the research. Within this section, we also provide a very brief write-up as to why the evidence was graded as high, moderate, low, or very low. And we refer readers to evidence profiles if they're interested in reading more. So evidence profiles are very detailed explanations of all of the research that informs the recommendations. And you can find this information on our website under the methodology documents section. And later on in today's presentation, we'll show you where exactly you can find that information if you want to go deep in and take a look at the research evidence. Content for the benefits and harms section comes solely from the systematic reviews, and we try to keep this section as succinct as possible. On this slide, you'll see that the benefits and harms section is then followed by a section called values and preferences. And here we present any information found that speaks to the worth or importance of the health outcomes that the panel selected following a particular action or intervention. So the content here can come from the systematic reviews, or it also may come from the expert panel. And following that, we have a section on health equity implications. So it really relates this section to how the recommendations may impact health equity across populations, or perhaps considerations that need to be made to ensure health equity when implementing the recommendation. So this might come again from the systematic review, or it might come from the expert panel. And finally, at the end of the discussion of evidence section, you'll see a section called expert panel justification of recommendation. And this is really where we summarize why a recommendation was made and why it was rated as strong or conditional by the expert panel. So we wrap everything up and summarize why they came to this decision based off of the evidence. Earlier on in today's presentation, I started to talk about strong and conditional recommendations, and we wanted to show you a little bit more information about what these two types of recommendations mean. There are several considerations that need to be made when considering the strength of a recommendation. The most important factor, as we stated before, is the certainty of the evidence. So if the research shows benefits for the action, but our certainty of the evidence is low or very low, then perhaps a conditional recommendation is warranted. But if our certainty in the evidence is moderate or high, it could lead to a strong recommendation. In addition, in order for a recommendation to be strong, the benefits would need to outweigh the harms of a recommended practice, and most people would benefit from the recommended practice. And for a conditional recommendation, the benefits probably outweigh the harms of a recommended practice. The majority of people could receive the intervention. However, there may also be a need to consider more closely a person's values and preferences for the action or intervention. Some people might not want to receive it. If you have questions later on as well about certainty of the evidence and how the RNAO team makes a judgment about the certainty of the evidence, there's quite a bit of criteria with the grade methodology that we follow. So I won't go into great detail about that, but if there's questions at the end, happy to answer that. And there is also more information about this that can be found in the appendix sections of our guidelines that goes into detail about what factors need to be considered when rating certainty of the evidence. I also want to draw your attention to this slide here that talks about the differences between good practice statements and recommendations, because you may be seeing more and more frequently good practice statements in RNAO's best practice guidelines. Despite the fact that good practice statements and recommendations are developed differently, both provide comprehensive guidance on an action or intervention that should or shouldn't be done. And so they're both very important to be thinking about and important for implementation. This slide walks us through the differences between them, but they are both action-oriented statements and they follow the same process for implementation. So good practice statements on the left-hand side, as you can see, they are actions that must be done in practice. They might be seen as common sense actions, but they might not always be happening in practice. Hence, there is a need to reinforce them in the guideline and state that they need to be implemented. We have high certainty that the benefits of this action would outweigh the harms, and we don't need to do a systematic review to know that the benefits are going to outweigh the harms. In addition, researchers may no longer be conducting studies on the topic area because it's so established and the benefits are well known, or perhaps the alternative to doing the intervention would be unethical or against human rights. So as we mentioned before, good practice statements don't receive a rating of strong or conditional, but they should be interpreted as strong recommendations. An example of a good practice statement would be conducting an assessment before carrying out an intervention. We don't need to do a systematic review and review all the evidence to know that it's important to conduct an assessment before carrying out an intervention. Recommendations, however, are also action-oriented statements, but they're developed based on evidence from a systematic review. So they answer a research question about whether an action or intervention should or should not be done. Maybe there's a question that's being debated by the panel and by experts in the field about whether something should be done. So the RNAO team will dive into the literature and will do a systematic review and will present that information back to the panel, and that will inform a recommendation. So again, they are rated as strong or conditional, and we determine that by looking at the certainty of the evidence, benefits and harms, values and preferences, and the impact on health equity. Both statements, though, are action-oriented practices that should follow the same process for implementation. So here we just have an example of a good practice statement and a recommendation that comes from our vascular access BPG. The example of the good practice statement is that health providers should complete a systematic assessment of the person prior to inserting a vascular access device. So this is something, again, completing an assessment. We know it's good practice and we don't need to do a systematic review to know if we should or shouldn't do an assessment, but it may not always be happening in practice. So therefore, it's reinforced in the guideline. And recommendation, the example here is that the expert panel recommends that health providers use ultrasound-guided technique for the insertion of peripheral arterial catheters. So the panel was interested in knowing, is there really a benefit in using ultrasound-guided technique? Do the benefits outweigh the harms? And from that systematic review came this recommendation that yes, they would recommend using the ultrasound-guided technique. Moving along here, we have the section on research gaps and future implications, which we're going to speak to quickly, and implementation strategies. So following the recommendation section, we always have a section on research gaps and future implications. So in this section, we address any research gaps that were noted when we conducted the systematic review. Perhaps the panel was interested in knowing the impact of a certain wound care product on the healing of a certain wound, but we didn't find any research to answer this. This might be listed as a research gap in this section. The research gaps and potential areas for future consideration are outlined for each research question. Finally here, we've got this section here that we wanted to show you on if you're looking for more information on how a guideline is developed. So if you're looking for information about this, each guideline contains an appendix with a detailed description of the guideline development process. You can also head to our website and look at the methodology documents section. This section includes information about search strategies from our systematic reviews, research articles that can be freely accessed that informed the recommendations. And thanks so much, Andrea. Andrea is showing us here on the slide now. If you scroll down and go to the methodology documents, you'll see a number of different documents that aren't included in the actual BPG, but could be very valuable for people who want to know more about how the guideline was developed or the recommendations. So we have our evidence profiles, we've got flow diagrams for our systematic reviews. If you really love research and want to dive deep into knowing where everything comes from, this is a great place to start as well. Thanks so much, Andrea. We can jump back to the PowerPoint. We do get questions sometimes from people of where they can find this information, so we wanted to share with people this information is available for you too. Now, at this point in time, I'm going to pass it over back to Steph, and she's going to share more with us about implementation of guidelines.
Thank you, Lindsay. So in this section of the presentation, I'll be discussing the information that's available in the BPG to support the implementation of the recommendations and good practice statements. So Lindsay's taken us through how the BPG is a little bit about how the methodology works and how the BPG is developed and the rigor that goes into it. So this part is really about how to make the evidence in the BPG come to life. How do we walk this out? So in the next few slides, I'll be referencing this information a little bit more specifically. So I'll pop over to the next slide. So thanks, Lindsay. Just the one, yeah, perfect. So what are the resources that are included in the BPG that support the implementation of the guideline? So you can see from the bullet points here, these are some of the areas or the focus that I'm going to be speaking very briefly about in the next few slides. And first, what I'll get into is just going into how to use the BPG. So at the beginning of the guideline, you'll find the table of contents. So Lindsay had spoken to that particular component. So you always start at that point. I don't have it on this slide, but right before the purpose and scope, you'll find a section that references how to use the guideline. This section provides 3 summarized steps on how to implement the BPG. And I'll use the Transitions in Care and Services BPG sort of as an example. If your organization is adopting any BPG, the RNAO recommends organizations establish, this is me reading that section, how to use a BPG. The RNAO recommends organizations establish change teams whose responsibilities include, but are not limited to, the following. Number 1, conduct a gap analysis or opportunity analysis, which includes assessing your existing policies, procedures, protocols, educational programs in relation to the recommendations, good practice statements, and supporting discussion of evidence in this BPG, and identify any strengths, needs, or gaps. Number 2, note the recommendations and good practice statements that are applicable to your setting and that can be used to address your organization's existing priorities, needs, or gaps. Number 3, develop a plan for implementing recommendations and good practice statements, sustaining best practices, and evaluating outcomes by applying the social movement action framework and knowledge to action framework. So I read all that just to say that that's where you would go in the guideline to just sort of see a summary of how to implement the guideline. The next bullet point speaks to supporting resources. So the supporting resources are the tools, strategies, and resources that are specific to the recommendations or good practice statement. In the example in the slide on the right-hand side from the 2S LGBTQI plus health equity BPG, we see a form and an educational guide, which is an educational guide that's referenced to support the creation of LGBT affirming spaces. And so what we do is include in our supporting resources exemplars that have been proposed, that are either from the literature or proposed by the expert panel to include in the BPG. So that's an example of a supporting resource that can help in your implementation. Implementation tips, which were previously known as practice notes. They describe the who, what, where, when, and how related to implementing a recommendation or good practice statement. And the appendices also contain a wealth of tools that you can put and gather as part of your tool belt. And I'll be describing and discussing the appendices and the reference to the leading teams toolkit and the 2 frameworks in the next couple of slides. So in summary, before I go to the next slide, these are the components that you would use to help with the implementation of the BPG. So on the next slide, you have the appendices. So you've got the snapshot of the table of contents, and you've got the appendices and all the appendices that are listed in this particular guideline. So appendices, as many of you know, contains supplementary material that may be helpful in providing more comprehensive understanding of the guideline and the implementation of the guideline, but may be a bit too cumbersome to add to the body of the guideline. And when I was preparing this presentation, I was thinking about a personal experience. In my past life, I used to be an educator and use the RNAO best practice guidelines to develop education in various settings. And I just was recalling how the appendices actually was my favorite part of the guideline. Not that the rest of it isn't important, it is key, but the appendices were where I was sort of like, oh, these are the tools that I can add to my tool belt to be able to walk out whatever it is that I was educating on and walk out the evidence that's in the guideline. So it's again that area where you can gather the tools for your tool belt. So in terms of the appendices and how they're usually formulated, typically they all contain different tools, different documents, but typically you can see on the right-hand side here, the appendices will contain a glossary of terms, which includes terms and definition of terms and concepts that are within the guideline specific to the topic. And they also include BPG development methods, the resources and tools that can support implementation of the recommendations. They also contain checklists, diagrams, and algorithms. So other examples of what the appendices may contain would be a description of how the indicators are formulated. And there are other examples of what are in appendices on the next slide. So we'll just pop over to the next slide, Nancy. So here you can see an example of implementation resources contained in the appendices. On the left, you'll see a document that's contained in the appendices of the Transitions in Care and Services BPG called the Patient, Family, and Caregiver Declaration of Values for Ontario. And it was mentioned throughout the BPG, is mentioned throughout the BPG, and it's a key document pertaining to transitions in care and services. And when I was working on the Ontario Health Team, the Ontario Health Team portfolio, it was a document that was referenced a lot. And so it is contained within that BPG, something that many of you may be familiar with. On the right-hand side, you'll see another example of a document in the 2S LGBTQI plus health equity BPG, which is an example of inclusive symbols and flags. So those are the areas within the BPG that support the implementation. To dig a little bit deeper into this area, in the next few slides, I'll briefly discuss what change teams need to prioritize in reading a BPG, and also what partners in change or stakeholders need to know when reading a BPG. So with all of this fabulous evidence-based information in the BPG, what, in other words, are the priority areas for change teams and leads as well as partners in change. What is it that they actually really need to know? So we'll pop over to the next slide. So as previously mentioned, we'll talk about the change team's leads and partners in change and what they need to prioritize. And you see two tables here, kind of separating out what the key areas and needs focus, what the focus of the needs are in terms of what they need to know. So to be most effective, all change teams need to engage others involved in the change and actively seek their input to support the uptake of change. So that's collectively, this is what change teams need to do. On the left-hand side, you'll see that those guiding and leading the change process need to read the BPG in detail and start to formulate a plan to determine priorities. So as it relates to the BPG, on the left-hand side, you can see here from the checklist that they will have to have a deep or in-depth understanding of all of the recommendations and good practice statements. They'll need to know contextual factors that may impact the implementation of the recommendations. And for this, you would go to the values and preferences and health equity section to see how they may relate to the population your organization serves, which is key. They'll need to know the differences between recommendations and good practice statements. And they'll also need to have an in-depth understanding of the evaluation and monitoring indicators. On the right-hand side, for partners in the change, and those partners in change might be point of care staff, they might include your PSWs that you work with, they might include individuals with lived experience, groups or organization that have a vested interest in the change. They will need to know or have knowledge and understanding of the recommendations and good practice statements, especially those that are being implemented within your organization, and they will need to review and understand the implementation tips and the appendices so that they can access the tools that can assist in carrying out the recommendations and good practice statements. So although we have separated the roles and areas according to roles in the change team, it's important to know that everyone in the change team is involved in the change, and it makes a difference in the implementation, is involved in that change, and it's important that everyone have a good understanding of the BPG. We also understand that roles may change and they may overlap, but what we've shown you here is sort of a general separation and identified where different areas, different folks within those teams will need to focus in on the BPG. So I'll pop over to the next slide. So here, many of you may be familiar with the Leading Change Toolkit and the two frameworks used to support change. So in linking one of the two frameworks, the Social Movement Action Framework, to guidelines, the Social Movement Action Framework emphasizes the engagement of people first. It promotes active and robust engagement of point-of-care staff, individuals receiving care and their families and other stakeholders when implementing knowledge tools such as RNAO best practice guidelines. In social movements, when change is valued and necessary and aligns with people's norms, beliefs, and culture, it can be a facilitator that positively speeds uptake and spread. So this slide shows a link between the social movement action precondition of change is valued and necessary that you can see in the little green box on the left-hand side under preconditions. And it shows that link between that and the discussion of evidence within the Transitions in Care guideline, which is just a Transitions in Care and Services guideline, which is just an example that follows each recommendation and includes sections on values and preferences. So when reviewing the values and preferences highlighted in the literature, it helps connect the values and preferences of folks that are part of the change team to the population your organization serves. So there's a connection there. And you can see from the evidence what is important to that population that was seen, that was researched in the evidence and your change team. And that connection can help to further accelerate your change. The next slide will make the link or connection. This is the next slide here between the knowledge to action framework and use of the guideline. So here, the knowledge to action framework describes how knowledge is made and implemented through 7 action cycle phases. You can use the framework to support the uptake and sustainability of knowledge through a structured change process. So this is a process framework. It's a step-by-step process framework. This systematic and comprehensive change model is based on change theories from the field of health, social sciences, education, and management. These 2 frameworks, the knowledge to action and the social movement action, are part of the leading change toolkit, which also supports the implementation of the guideline within your change team, and what was mentioned at a few slides back on the presentation. As you can see from this diagram here, in the knowledge to action framework, the work of the guideline development team takes place in the middle of the diagram where the BPG is created. So in this sort of funnel, upside down triangle, you can see here, that's where the knowledge creation begins. And that's all the work of the guideline development team. The next step is for your change team, which is below it and is captured in that green box there. This is the first step of the knowledge to action framework in terms of process. And it begins with your change team identifying, reviewing, and selecting a BPG, which is titled underneath the diagram. It's important to select a BPG that addresses the identified problem and confirms that the purpose and scope are in alignment with your issue, your identified problem. This is a key part of the first step of the implementation process. If it does, you would then read the recommendation statements and the supporting discussion of evidence, and based on your role in the change team, you may continue to develop the competency of a content expert or content expert, and it would move forward from there. You will move forward from there with integrating the evidence and walking out that evidence. If available, for those of you that need further assistance with implementing or understanding the guideline, you may want to connect with a clinical educator or researcher on your teams who can help you read and interpret the guideline, if that is a part of your role. So in conclusion, taken together, all of these in terms of implementation, these are brief examples of how to find key information within the BPG to bring it to life in your organization. What information to prioritize when reading the BPG based on your role, and how to link the 2 implementation frameworks from the leading change toolkit so that you're totally equipped to implement a successful change in your teams. So on the next slide, this final slide, in terms of content, maybe a review for you, but we wanted to draw your attention to how to become a champion. As champions are key, as you already know, are key roles, are key drivers of change in any change team. The Best Practice Champions Blended Learning Series is a free, when we love free, online educational opportunity for healthcare professionals and others who are passionate about evidence-based practice. The updated curriculum draws from RNAO's leading change toolkit that I mentioned previously and the new Best Practice Champions competency framework. So it's new, it's amazing, it's dynamic. You'll be introduced in this education to the RNAO's best practice guidelines and gain strategies for driving change in your workplace or academic setting. You'll also become part of a community of champions committed to driving positive change in healthcare. So in terms of the components of this education, there are 4 parts to the learning series. There are 2 e-modules, 2 interactive virtual live sessions, and this series will guide you through 3 phases of change: planning for change, making change happen, and sustaining change. So as mentioned, the content is new. It's updated, it's fresh, it's excellent. It's designed to empower champions yourselves to build capacity as change agents. You can complete the blended learning series parts at your own pace, and that's what's amazing about this, or in sequential order. The live sessions are offered monthly, which are part of this training, and I believe the next sessions are coming up soon in early December, and we can share more information about that. So please do take advantage of becoming a champion in the education. So now it's time for questions. We have some questions for you that we would like to present to you, and you can certainly respond to those questions in the chat. We will have someone on the team review the responses,